Good afternoon. This is Rachel Leventhal-Weiner, the Chief Research and Planning Officer for the Office of Early Childhood. Thank you for joining us this afternoon for an announcement about a new program called CT Cares for Childcare Businesses. We ask that you share questions that you have throughout the presentation using the questions pane of the GoToWebinar tool, and we look forward to hearing your thoughts. And with that, Commissioner Bye.
Thank you so much, Rachel. Welcome, everybody. Happy Monday. This is a second time we're going through this webinar, so we have some experience with questions, but every time we talk to folks about it, we learn more and we answer more questions and we improve upon things. So we're glad you're here. Also want to thank Ulysses Romales, who is doing interpretation for us today over in Teams. We wanted to be able to offer this in 2 languages. I know there has been some challenges getting in, but people are now arriving, so we're glad you're here. What I'm going to do today is walk you through our OEC Connecticut Cares for Childcare Businesses program. The idea is that we understand that these are incredibly challenging times, and we have been able to use state funding for state-funded programs to stabilize those programs. They still face many challenges, much like private programs, but we've had those tools to help them. But we also knew that there were a lot of private programs who were also facing challenges and needed to be supported. So I'm really glad to talk to you today about a program that's really targeted. A lot of the funds are targeted for private programs that receive less than half of their funds from state sources. Teal is going to walk us through this, and I also want to thank the OEC team, something called Emergency Service Function 14, which is part of the state's unified command. But we have our own Emergency Service Function 14, which is about recovery, and Margaret Gustafson has been leading that work, and I'm really grateful for her leadership. And the whole team at OEC. Deb Fliss has been supporting her as well as many other team members. So we have goals of working to help build a Connecticut that offers safe, high quality programming for all, that's accessible, equitable and inclusive, evidence-based and supportive. And you are really our partners in that work. And we know it takes all different kinds of settings to be able to serve different family needs. So we appreciate that. Also, we hope that you're finding us to be responsive. I know we get hundreds of emails and calls each day, and we're doing our best to support you through what is an incredibly challenging time. Okay, Keel, next slide. So what we're going to go over today is we're going to go through some of the reflections that we've heard from our small businesses, talk about the principles that guided this program and starting this program, talk through some of the results of the business survey that many of you on this call completed, walk you through what are the benefits of the Connecticut Cares for Childcare business, and also I think what you're going to hear, if you hear us, if I do this correctly today, is that we have a package of supports in place, because none of us think that in a month everything's going to be back to normal. We believe that we need to be thinking through supports for programs for the next 6 to 12 months, and this is a beginning of that. And as part of this package, you'll hear about some other kinds of services that we have. Okay, and then we'll take time for questions and answers. Here are some of the quotes we received when we sent out our survey to programs. We've also heard in emails and calls from you as well. These quotes.
Excuse the interruption, but have we started? Because I'm having trouble with the audio on the phone line. I've just switched over to the GoToWebinar app.
Yes, we've started.
Okay, I'll stay on the call then. The other call isn't working, so I'm on this now.
Okay.
All right, so, apologize. You can continue.
That's okay. Don't apologize.
I'll brief the Microsoft team real quick, and then I'll signal you to continue. My bad. I apologize.
All right, you tell me when to continue. We really do want to have these webinars interpreted. We understand that for some of you that Spanish is
Golden. Go ahead.
Your first language, so we want to take the time it takes to make this accessible to all of our providers. So Thanks, Ulysses. So apparently they can hear now on the other side. So, but there are a lot of worries about the cash coming in, about gloves, how do you get the disinfecting items you need? I talked to one provider who's having her son from out of state mail in supplies. So I know that's been difficult getting supplies. We hear that all the time. People aren't comfortable taking on debt at this time, and really concerned about their staff. I mean, a lot of you, your businesses are like family, and you've been with people 2, 3, 5, 10, 20 years, and you feel a big responsibility, and we heard that loud and clear. Louise Stoney, who's a really well-known business consultant or early childhood consultant, she's been an innovator for decades. She correctly points out that the current business model in ECE is really challenged, and the pandemic has made that worse. And so what we're trying to do with this package is to look ahead and think about how can these grants be the beginning of supports that you get, and also be ready. We're advocating really hard for additional federal funds that we can send out to programs. Okay, Teal. So we started with some guiding principles as we thought about this care package. One is that first, the health and safety of children and families come first. We're looking to maintain and expand access to high quality programs. And we know there are a lot of buckets that make that happen that you can see under there: financial support, workforce, the business health, and trying to build capacity. We also want to make sure that where it's possible that children can continue with the same child and teacher and program, that we want to support the programs that exist so families can come back. We also, in this work, wanted to make sure all voices were represented, all different kinds of settings, small settings, large settings, family childcare settings, group family childcare homes, large center-based care, small centers. So we just want to make sure that we heard from everyone, and we really did in our survey. And then try to keep the operations of the Connecticut Cares for Childcare business simple. Keep the reporting simple. Okay, Teal. So this was really shaped with your input. Almost 40% of our providers replied to our business survey, and it wasn't easy. It asked for a lot of really specific information. You were forthcoming and honest, and we were able to use that to develop the guidance for this survey. We heard from you. For example, one of the options we had was to think about finding some low cost or no cost and use some of this funding for loans. And you said pretty clearly, that's not what we want. We're cash strapped, we need funding. And so you're gonna see how your input during that survey helped guide us. It was voluntary, and we heard from more than 1,500 programs, which is unbelievable. So that information is going to help now, and it's also going to help us as we go forward and plan with you as an agency. Okay, and here's some of the data. I know I saw the full report come in Friday, so that'll be available on our website. And you can see when you ask programs, how detrimental has COVID been to your program? Virtually all of you said it's been very detrimental. It's had a significant impact on your operations. So that's very meaningful. Okay, next. And this one I really like because it sort of looks across some of the concerns you have. And when we think about, like when I think about the long run, this first one, the concern about families returning after COVID-19, in some of our talks with some of the national thinkers and funders, we know it's going to be a little while, and we know you're worried about that as well. So we're trying to think about that in our work. We know so many of you have invested a lot in your staff, and you're worried about them coming back because of those investments. It's always a worry when you run a business that some of your best people leave when there's a break in service. But you know that your lost revenue has been a huge challenge. As you can see, that one has the highest prevalence. You're concerned about purchasing PPE. employees being out, how are you going to keep paying them? And then you have all these other expenses. Even when you weren't open, you still had mortgages, you still had electricity. I talked to many of you on the phone and could just hear the concern and how hard you're trying to figure out how do we keep going given all these challenges. So we really appreciate your responses. Okay, next. And this is when you told us what you needed. This is what guided our decisions about what to do with the federal CARES dollars that we got with the private program. So obviously cash flow is the biggest concern, but you also are concerned about supplies. And so you're going to hear as we talk through the program that these really were the top line items, how we spent the resources. But you're also going to see that we've also invested some in business supports and in helping you with things like first aid. So we really tried to create a package that would help you for a period of time. But these results, I think, are really interesting. Okay, next. So as I've been trying to say, this isn't just one thing. There are phases and layers of supports for you. We know that there was the immediate disaster, which we're slowly coming out of now. And I'd say now we're in the short-term recovery, which is how do we reopen? What do we need to reopen? Who's coming back? What's the demand going to be? These are all things we're figuring out in the short term. And then for the long run, how do we prepare for the next phase of business operations as things return to more normal? But we know, again, it's going to take months. So we know that there are many layers. So initially, our office worked with many of you, directing you to Department of Labor, dealing with the unemployment challenges. And then Head Start committed to paying programs. So the Head Start programs were able to stay open. And OEC committed to paying the state-funded programs. And then we rolled out a suite of programs, one to support hospital workers with 23, I think we had 23 different childcare sites serving 28 hospitals. That was the first thing we rolled out. And then we also rolled out supports for frontline workers with payments made directly to childcare programs. Bonuses, what we call Connecticut Cares for Childcare. Those are additional funds to support the additional expenses that you've been dealing with if you were operating during COVID. And then the final program we've launched now is Connecticut Cares for Family Childcare to set up supports for family childcare throughout the state of Connecticut. And in fact, the work on that grant and listening to family childcare networks also helped guide some of what's in here for small programs, which a lot of those you'll see by the size are family childcare. And then we tried to let you know about loans and grants that were available. Some of you accessed PPP. Many of you worked with your banks and the Small Business Administration. HEDCO had a loan program that some of you have accessed. And then looking for ways to think about getting reimbursed for medical leave. So we made those opportunities available, and some of you also relied on private loans and grants to get through this difficult time, though most of you said out loud that was not your preference, because you know how hard it is to get a profit in this industry. So, it is going to be multi-layered. Next slide. So I can't go through this without saying that we still need additional federal funds. What I'm going to talk to you about is helpful, but is certainly not sufficient. It's not going to cover everything you need in order to stabilize your business, because it's been a really challenging time already, and it's been months, and we know we have a few months left in front of us. So we're really hoping we get additional federal funds to help support programs so they do not close. And we need these emergency funds for childcare providers. So anyway, so we're using these federal funds that we have now to provide some supports, but it's just to say that we need to continue to advocate, to listen, to plan and respond at this difficult time for childcare. this is not enough. We're happy to announce it, and I think it will be helpful, but we don't pretend it's enough. And we're in partnership with you trying to get additional federal dollars. Okay, next slide. So this is a flyer that is available on our website as well that sort of explains the package. Again, back to the point that I've already made 4 times, that it's not one thing. But it begins with the Kickstart grant to programs based on program size and accreditation status. Then there is also a supply subsidy. We want to support some of the training and professional development that you need to do. We have been supporting background checks, and that stopped, but we're going to continue to do that through this transition period to provide some financial relief. Then we are partnering with the Women's Business Development Center to stand up business supports throughout the state for childcare programs, and that will also include some supplies you might need for enhanced business operations. So a lot of the funds going there are ultimately going to programs as well. And then access to the other CARES programs and communication support. So it's what we're trying to put together are a lot of different supports to help you, but we do know that you need funding in the short term. Okay, next slide. So the first thing I'm going to talk about, which is the Kickstart grant. We've applied $8 million of the federal funds for early childhood ed. We're going to have this application open from July to mid-September. It's open to all kinds of programs. This is for programs that were operating in January of 2020. It's meant to sustain programs. Programs have to be open or verified reopening. This is the part that I want to be really clear about. The expense Kickstart grants are specifically designed for private programs that we've not been able to help out with some of the stabilization funds. So if your program received less than 50% of its revenue from public funds, that is state or federal, then you qualify for this Kickstart grant. It is for part-day programs, and it's just adapted for part-day versus full-day. And it also is giving additional funds for accredited programs, whether it's Family Childcare accredited or NAEYC accredited. Next. Okay, this is the expense amounts for Kickstart. So, Teal, I'm going to ask you to leave this slide up for a bit. On Monday, it went really quickly, so people can take a look at it. So the size of these programs is based on NAEYC accreditation sizes, and we combined large and extra large. But extra small program would be less than 12 children, so less than or equal to, so this could be a family childcare home or a group home. The expense Kickstart grant is $1,850 one-time grant. If you're accredited, you get an additional 20% for $2,200, and then it gets larger as it goes. And the way that we structured this had to do with the information, the financial information that we got from the questionnaire. So the team really did some detail work to get to these amounts. Okay, next. So the supply subsidy is open to all programs, whether you're state funded or not. This is understanding that you need to buy some additional PPE for your staff, probably extra cleaning supplies. It's difficult to find them and sometimes more expensive. So this too will be open from July through mid-September, all kinds of programs, and including youth camps. So youth camps are eligible for these supply subsidies as well. Again, the program had to be open in January of 2020, except for camps because they're not open in January. And they have to be open or verify that they're reopening. There are no revenue restrictions on this. And again, it's the same kind of bonus for accredited, Family Childcare or NAEYC accredited. Okay, next. So these are the supply subsidy amounts. So these are, again, one-time grants that are going to come to you that you will use to provide supplies, to buy supplies for your program. And you can also see the accreditation increase here as well. So if you're a small program, you'll get a $550 supply subsidy, but if you're accredited, you would get $660, and so on. If you're large, you would get a $1,900 supply subsidy, and an accreditation increase would be 20% at $380. So all told, large programs will get $2,280. And I did have questions about what about a program with multiple sites last week. This is set up to be per license. So if you are say a network of programs, it would be this much per licensed program. I hope that makes sense, and I'm happy to clarify during the questions. Okay, next slide. So applying for the subsidies. I want to just take a minute and talk about OEC and rolling out these programs. So many of you probably are participating in Connecticut Cares for Childcare. That is a program, a technology that we had to stand up in 3 to 4 weeks in order to pay programs because we know the stress that programs are under. But we know that it's been rocky because we literally built it as people were applying and then had to upload information, and about 10 to 15% of you, of those listening on it, had a very difficult time getting paid and maybe just got one lump sum last week or coming this week because there were challenges with the technology. There were also challenges when people would upload the documents and the document wouldn't be right, and we wouldn't know that till a couple weeks. And so it didn't go as smoothly as we'd like. So Connecticut Cares for Childcare Business has about 4 times more people than Connecticut Cares for Childcare. And so we are being really cautious with the technology. We've assigned an additional 10 people to help with the help desk. We want to have live help because we just had an email on the last program, and that was not, people do not like that. They don't find that helpful. We're trying to be helpful. We don't want to add frustrations, and we know we added some frustration with Connecticut Cares for Childcare. But that said, it's been a great way to use our federal funds to help you who are helping our children and families in Connecticut. So what we're going to do is it'll be a 2-step process to take this, to make it more smooth. Starting, I believe, starting on Friday, you can register as a vendor through CT Cares, and we will send a notice out with the links for this. And then after you register as a state vendor, then we will send you out the expense Kickstart grant and supply subsidy application, and that will be open the week of July 6th. We believe that by staging it and getting all the information we have before you start to submit for payment, that things will go more smoothly. And also we've worked it out so that eLicense will load a lot of your information right into the application. So our IT team has been working overtime, just so much to make these technologies work. For example, Connecticut Cares for Childcare, standing that up in normal times would have been a 1.5-year process with technology, with all the different RFPs, all the different mechanisms. But we knew it was an emergency, and the governor had some special powers at this time, so we could get dollars out quickly. So we did what would have been 1.5 years in 4 weeks. And so with that, we're sort of still fixing some of the bugs, but we're sorry for the delays there, but we've learned from it, and we want to make sure we have the capacity internally when we roll this out on Friday. So thank you for your patience. Okay, next, Teal. So we also have these other care package supports, and you can find them, you can see here on our website, and then very soon we'll have an announcement about sort of the resources that you can access from the Women's Business Development Center. We are signing that agreement very soon. I think we've signed it. We're just finalizing the details, and then they will let you know what's available. And we will also notify you about background checks and MedAdmin training as well. You can also access scholarships and online training right now through your registry account. So those are available or will soon be available as well. So I want to close by saying thank you for what you're doing for Connecticut's children. We know it's been incredibly challenging. We know, I'll keep saying, we're very pleased to be able to roll this out to our private programs, but we know it's not enough, and we're going to continue to advocate with you for more support from Congress. And we're doing our best to work with the Reopen Committee on items that we hear from you about to be helpful in other ways. And we'll continue to listen and just really grateful to partner with you at this time. It's important to keep in mind that it is nothing any of us have ever lived through together. And I'm so incredibly proud of the early childhood field. And I'm really proud of the team at OEC for what we're all working to do to support you. We know we can do better. We'll keep listening. And now I'll take your questions.
Thank you, Commissioner Bye. This is Rachel Leventhal-Weiner again. We've been handling questions in the questions pane around interpretation. So thank you for your patience as we responded to individual questions around interpretation. We've sent people directly messages to join the interpretation link in Microsoft Teams, and we apologize if there was a delay or confusion about that. So Commissioner Bye, we have some questions around who can apply and about accreditation specifically. If someone is in the process of pursuing accreditation, or if they are accredited by someone other than NAUIC, would they still be eligible for that? Now,
I know that question came up. For example, Montessori accreditation came up. I'm going to ask Deb Fliss if she has an answer to this one. I know it was intended for NAUIC accreditation, which is sort of the investments that we've made over the past 20 years as a state that we're working to protect. But Deb, I know I saw that answer on Friday. I just can't quite recall.
Yes, the accreditations that we're recognizing are National Association for Family Childcare and National Association for the Education of Young Children. And to the question of whether programs that are in the process will be eligible, yes, those programs are offered a bonus of 5% if they are in process for the first time. And we're working with both of those organizations to determine what documentation a program or a provider will need to produce in order to document that they are in process. And that documentation of being in process will be viewed as consistent with the rest of the benefits of this based on a program or a provider status as of January 2020.
Great.
Okay, thank you.
So there are questions around who can apply, and I believe you said this, but I just wanted you to reiterate.
Yeah, I'll reiterate. Sure.
If you've already applied for a CT Cares program, talk a little bit about that.
Oh, you know, that's a really great, I'm so glad you asked that question. This is why the questions are good. So I talked about applying to be a state vendor. More than 1,000 programs already are state vendors from the Connecticut Cares program. If you have registered there, we are working to carry all your information over so you don't need to go through that process again. So if you've been receiving funding from Connecticut Cares for Childcare or Connecticut Cares for Frontline Workers, then you are already a vendor. If you were a Connecticut Cares for Hospital Workers program, we have about 23 of those. Those are not currently state vendors unless you're also getting Connecticut Cares for Childcare and Connecticut Cares for Frontline Workers, because CREC was our fiduciary in that case. But to apply for the Kickstart grant, you need to have less than 50% of your revenue come from state resources. To apply for the subsidy grant, any program can apply that's licensed. It has to be a licensed early childhood program in the state of Connecticut. Okay.
Great. So could you speak to programs that aren't the timing of this program? So some programs may not open until August, or some that might be open now might be serving school-age children, but might serve younger children beginning later this summer. So if we could speak to that.
Well, if a program is open as a camp now serving school-age children, they could get a supply grant, not a Kickstart grant. If the
Okay.
program is opening in September, that's why we're keeping the program open through September 15th, is so that July 6th to September 15th is a good period of time, so programs can apply as they're opening, or I think very close to opening, like that it's imminent. So that's how that works. And so people know the funds will not, we have plenty of funds. We literally, again, because of the information you sent us, we have very good data about how much this is going to cost, what programs qualify for. And so it's not a kind of situation where if you don't apply till September, the funds will be gone. The funds are there.
That's really helpful. We have some questions around the CT Cares program in general and payments, payment delays, and when payments will go out.
Yes, as I mentioned, that has been really challenging as we built the system as we were going. I know that like last week, 1,900 payments were processed. So I know that there are a whole lot of payments on the way. If you have individual questions about your case and have not reached out to the Connecticut Cares for Childcare mailbox, you can email me and I'll get it to the right person. That's beth.bye@ct.gov. And I know I've emailed and corresponded with a good, 50 to 100 of you related to this. And again, we apologize for the delay. The idea is to be helpful. But it is complicated getting $5 million out directly to programs. I will say this, is that we've learned a lot. It puts us in a position that if we get additional federal funds, that programs will be set up so that we can continue to support programs. But I will admit that the beginning has been bumpy. So we will get to as quickly as we can. And if you're having a particular problem, you can email me at beth.bye@ct.gov and I'll do my best to get you an answer quickly.
Thank you for sharing your contact information. We do have some folks in the questions pane offering up some specific situations. And so I do encourage you to get in touch directly with Commissioner Bye, and we're also going to be putting in the chat the contact information for this specific program so that we can attend to everyone's questions that they have quickly. Can folks apply prior to reopening?
I'm gonna pass that one to Deb Fliss because I know we've discussed this, and I just want to make sure I get the answer correct.
Yeah, the answer right now is that we will in fact be verifying the open status of programs. So a program that applies close to its reopening would expect that we would verify their open date through our own system. We would probably use our licensing staff to help us with that, to ensure that you are about to open and then be able to move your application forward.
Thank you, Deb.
All right, so there was a question in our last webinar, and it hasn't been asked yet here, but I think it's important to reiterate. The programs are based on enrollment, but we always get lots of questions around how enrollment is changing, and group size, is where it's at now, but it may change in the future. So can you just speak to how the funds will work based on enrollment?
Yeah, we based it on the enrollment of January 2020, which was like sort of the last full month, we believe, of operations, because we know that enrollment's different now, and we're basing it on your program size from January 2020.
We have a specific question about, so if you've already registered as a vendor, we have your information. You will not automatically receive an application for this program. You will have to go to apply for it, and we will share that information after July 6th, correct?
When the application is ready, we will be sending it out to programs that are state vendors to complete. We will, we want the programs to access this, so we will be emailing that out to programs once they've established themselves as state vendors.
So we have a question about whether the CACFP program counts as state funding. or that is federal funding, but would that count in your budget?
Nobody has asked that question yet.
I know.
It's intended to be tuition dollars. So I would say here, if your revenue related to tuition is less than 50% of the state, so look at your budget, look at your revenue for January of 2020, and then let us know if 50% or less is from state or federal funds, then you qualify. If more than 50% is from state or federal funds, you do not. I mean, I consider food to be a reimbursement for an expense that you've made to feed children. So I'm I'll ask Deb Fliss to confirm that, but we're looking at your revenue coming in, correct?
As we have written this, it is focused on revenue. I would agree with you that CACFP is a reimbursement program, not a revenue stream for providers. We will make sure that that is clear in the future instructions so that providers know exactly how they need to calculate their revenue to be able to understand how they qualify. And then the other thing I want to say, since this brings up the issue of reimbursement, is that there are some questions in the questions from today about whether these funds are reimbursements to programs, and they are not. The Kickstart and the supply subsidy are not reimbursements, and we will not be asking programs to provide receipts or documentation to tell us about expenses. We know you have incurred these expenses, and we will be providing the Kickstart funds and the supply subsidy to the levels identified in the charts based on program size, and not asking for documentation of expenses that programs have already incurred.
And once again, I think where we're leaning on for the federal government when we report about this is those surveys you gave us and the very detailed financial information we have about what programs, what the pressures they're under right now and the challenges that they're facing.
So we're talking about, we're just talking about supplies before, whether we could apply for them before people reopen. So maybe we can talk a little bit about supplies in general and the supply distribution that's been happening for the last few weeks through the agency.
Yes, I'll go first and I'll turn it over to my co-pilot, Deb Fliss. We have set up 7 distribution centers around the state. Initially, they were focused on hand sanitizer and soap, and those are very difficult to get. Now they are focused. Now the focus there is PPE for open programs, masks, gloves, boots. That is winding down, which is part of why we're doing the supply grants, is to say to programs, we're doing this while we can, but we know you're going to continue to incur costs for supplies. So we are setting up these supply grants for all programs. But Deb, I'll let you tie on because you're our supply lead.
Sure. I think the only thing I want to add related to that, hi everyone. The only thing I want to add related to that is that the previously distributed information from the Connecticut Business and Industry Association is no longer valid. They are no longer able to provide thermometers and other PPE, but we are hopeful that we will be able to ensure that our supply right now of masks and gloves will carry providers through for the immediate future to address their needs.
All right, thank you to both of you. So we do have some questions about the CT Cares programs, and our colleague Chris Liddy has added a contact information in the chat for folks who have specific questions, either about payment or about specific registration issues or data issues. So I think it's important to just take note of the email address ccc.oec@ct.gov. And you also have the ability to send a note directly to Commissioner Bye. She's very receptive and responsive. We have several questions about registering as a vendor with the state, and I will drop that information in the chat momentarily. We've had the same question a few times, and we said it earlier, but we'll reiterate that if you are already registered with the CT Cares programs, any one of the CT Cares programs, then we have your vendor information. That means that you're registered as a vendor with the state, and we will contact you when the application is available for these two programs. So no worries. As I'm just looking to make sure that we've attended to some of the questions that we have from our audience who's listening to interpretation, and as well, we have had some challenges with the interpretation today. So I appreciate people's patience as we've directed people to the right link in the right place. I also will put into the chat a link to our comprehensive guidance for childcare centers, and we're also completing our comprehensive guidance for family childcare programs. Those are two documents that bring together a lot of good information from all of the conversations we've had with childcare centers that have operated and childcare programs that have operated during this time. This might be a good time also to just give you a preview that we're having another conversation this coming Wednesday at 1 p.m. around programs that have been operating and some of their best practices to provide childcare during this time. I can provide a link to register for that webinar in the chat window. Commissioner Bye, there's one of the questions that we received is whether or not this the subsidy is taxable.
This is revenue, so yes, I mean, it does count as revenue.
Okay. And I just remarked upon the guidance that we received, and I think we are really in good shape in terms of questions. We've attended to most of the questions that we received today, but we may have some more questions coming in from our Teams chat. So, do you want to speak a little bit about
why don't I speak about the changes that happened over the weekend quickly, since I have providers on the call.
Yep, that'd be great.
So over the weekend, we were able to announce that effective today, the maximum class size is moving from 10 to 14. Just so people know how that happens, there are conversations with a group of commissioners from the state, Department of Public Health, Department of Economic and Community Development, State Department of Ed, OEC, and then additionally, there are probably 4 or 5 doctors on the phone, epidemiologists, workplace safety doctors, some workplace safety experts. And so the balance is you've got the business, you've got the child safety, and you've got the worker safety. And all of those items are discussed when a change is proposed. In addition, they look at what's happening in other states. And so Connecticut landed on increasing the class size to 14. The second thing that changed, this doesn't apply to family childcare as much, but for larger centers, we were requiring that OEC approve plans for programs with more than 50 children to assure that groups were kept separated. And that was leading to some different rules based on program size, which wasn't consistent. And so we now no longer need to approve programs bigger than 50 children, but programs still need to follow the public health protocols, class size of 14, extra cleaning, social distancing as much as possible. We understand they're young children, and staff wearing masks, et cetera. So that changed. And the other thing that changed, which is sort of change, and this committee sort of looks across government, it's going on across government, is about the temperature screens. Now, programs can continue to screen for temperature if they want, but the decision of the committee is that what's happening as they've been implementing screenings is that people back up and parents back up coming in, whether it's to summer school or to daycare. Also, you have an additional adult introduced who's taking the temperatures and screening the children if that's how it happens. And the value of the temperature taking when doctors know that children, when they have a fever, it generally doesn't express till later in the day, that it's much more important to have the cooperation of parents ahead of time and for teachers to keep a very close eye on children's health. than it is to screen, that some of the trade-offs of screening are, again, the not being able to socially distance and for parents to get backed up, et cetera. So we'll be updating our childcare guide with this. And I know I've heard from many of you and been corresponding with many of you about classroom size. At OEC, we feel like 14 is a good number, and it's better for programs than 10 in terms of the fiscal piece, but it's still significant reduction in order to maintain smaller groups, have more space in the classroom per child, and have more attention, more time to pay attention to things like cleaning. So we feel like this is an important change, and we'll be watching closely. And then come August 1st, we'll look at it again. And September 1st, we'll look at it again and readjust because we've got to watch what's happening in the state. A lot of why Connecticut's doing so well is because our citizens have been cooperating and they've been wearing masks and they've been social distancing. We know it's not perfect, but it's certainly much better than other states, and it's paid off in a much lower infection rate. I think we're moving in the right direction in Connecticut, and some of it thanks to the work of you all and the incredible work of the childcare programs that were open throughout the pandemic with the good hand washing, et cetera. So we still need a lot of attention to health and safety, but we think this is an important change for the fiscal stability of programs and for children and families who were having trouble accessing childcare. So we know that high quality early childhood settings are a really good place for kids to be. So those were the three main health and safety guidelines.
Great.
Deb, do you want to add anything? Did I cover those?
You covered them well. If I could just add, there have been a lot of questions over the last week or so about the guidance for family childcare. Folks are aware that we're working on that document, and at the end of last week, we were just about ready to release that document, and then these changes were made, and so we are updating right now. But what it means is that that family childcare guidance will be up to the minute current when we release it this week. And then we will go back and update the center-based guidance document so that all of the recommendations, requirements, and guidance are consistent with these changes.
But first we have to finish the family childcare, then we'll move on to the updating the center. Thanks,
Correct.
Deb.
Commissioner Bye, I believe those are all of the questions. I just wanted to remark that we have put a link in the chat window to the registration for Wednesday's webinar, A Day in the Life of Childcare as We Know It. So we have some feedback around the timing of webinars, and I just want to make sure that folks know we do try and alternate the times that we host these, sometimes later in the day, sometimes in the morning, sometimes midday, as we know that everyone's schedule is slightly different. So we appreciate that feedback. And if you have changes in your communication, it's best to contact your licensing specialist, since that's where we generate most of our communication to begin. And
I also think it's important to note that these are all recorded and people can access and view them at any time. And all the questions that are generated do get processed into frequently asked questions. So I apologize if the times don't work for many people. I've done some in the evening, some in the day, and we'll continue to try to rotate them. But do know the recordings are available. And this one will be available in English and Spanish to the extent for the part of it that was not interrupted by some of the technical challenges.
I am just about to add in A Day in the Life. I believe that I did not share it with the whole audience. I'm going to do that before we depart. And in addition, we will share a link to our COVID registration page, our COVID information page in the chat as well.
Okay, I'll just close by saying thank you for what you're doing every day. We know these are really challenging times. We do want to continue to partner with you. I'm really proud to live in Connecticut right now, and we just need to keep careful. We need to try to keep our staff as safe as possible, keep the children and families as safe as possible, and run the highest quality programs we can run for children and families right now. So have a great evening. Thanks again for joining us.